Hello everyone, welcome to Pediatrics by Dr. Anand. Let's start off this class. Beautiful topic of Chalo Milkar Padhe. Life is beautiful. We have to work hard. Everything will make sense by the end of the journey. All you have to do is just believe in yourself. So I'll be speaking all these points. Just listen to me and watch this video like a Netflix movie. Enjoy life, enjoy this process. Once you get the rank, imagine that feeling. Oh my god, that feeling is gonna be crazy. So enjoy life. Neonatology, very importantly, we all know that. So the 0 to 28 days of life is known as a neonatal period. The beginning 7 days of life is known as early neonatal period, and 7 to 28 days or 8 to 28 days is known as a late neonatal period. One more important point they ask in exam as what in an infant. So in the previous guidelines, like you can say 29 days of life till 1 year is an infant. Now they say from birth to 1 year. From birth to 1 year, it is known as infant. Okay, so we all know that. Then we have something known as 1 to 3, 3 to 6, and 6 to 12. So 1 to 3 year is known as toddler. 3 to 6 year is known as preschool, and 6 to 12 year is known as school going period. 1 to 3, 3 to 6, 6 to 12. Simple. Next question. Then they have something known as, very importantly, remember guys, adolescent period. So adolescent period, very importantly, 3 numbers I must remember for exam purpose. That is 10 to 13 years, 14 to 16 years, and 17 to 19 years. So we all know that 10 to 13 years is known as early adolescent period, 14 to 16 year is known as middle adolescent period, and 17 to 20, or some books say 17 to 19 years, is a late adolescent period. Which is the most common bone to get fractured in a newborn? The most common bone to get fractured in a newborn is clavicle. Okay, what is the normal capillary filling time? So the normal capillary refilling time, you can say capillary refilling time, or even you can say capillary filling time. The normal capillary refilling time or filling time is less than 3 seconds. Okay, like not -3, I would say less than 3 seconds. The normal capillary refilling time is less than 3 seconds. Please remember that. Which is the first carpal bone to appear in a baby? The first carpal bone to appear in a baby, we had, if you remember, we have this formula for lateral to medial. What are the carpal bones we have? We have she looks too pretty, try to catch her, right? She looks too pretty, try to catch her. So we have scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, and hamate. The first carpal bone to appear in a baby is the capitate, which comes by 2 months. The second carpal bone to appear in a baby is the hamate, which comes by 3 months. Leave the pisiform aside. Leave the pisiform aside. Why? Because it is the last carpal bone to appear in a baby is the pisiform. The third carpal bone to appear in a baby, very importantly, please remember, it is the triquetral. The third carpal bone to appear in a baby is the triquetral. The fourth carpal bone to appear in a baby is the lunate, and the fifth carpal bone to appear in a baby is the scaphoid. So these are the basic things you should know for exam purpose. Which is the most common congenital heart disease in infant of diabetic mother? The most common congenital heart disease in infant of diabetic mother, very importantly, the most common congenital heart is VSD, and most specific, if I ask you which is the most specific congenital heart disease, that is nothing but TGA. Finish. Next question. Which is the most common congenital abnormality in infant of diabetic mother? Then the answer is congenital heart defect is the most common congenital abnormality in infant of diabetic mother. Done. An infant of diabetic mother, very importantly, the mother will be hyperglycemic. The mother will be hyperglycemic and the baby will be hypoglycemic. Mother hyperglycemic, baby hypoglycemic. And what is the hypoglycemia cutoff in a case of this baby? So sugar less than 45. Sugar less than 45, that is the hypoglycemia cutoff in this baby. Number 1. Number 2, very importantly, as I told you, the most specific congenital heart in infant of diabetic mother is nothing but a TGA. Which is the most common neurological abnormality in infant of diabetic mother? Infant of the diabetic mother. The most common neurological abnormality in infant of diabetic mother is a neural tube defect. And which is the most specific neural tube defect? That is nothing but caudal regression syndrome, which is also known as sacral agenesis. Number 1. Next important point, which is the most common congenital heart disease in full cardiology? In the full cardiology, the most common congenital heart is a VSD, which is the most common acyanotic congenital heart disease in cardiology. Specifically acyanotic congenital heart, then again the answer is VSD. And which is the most common cyanotic congenital heart disease? The most common cyanotic congenital heart disease in day of life 1 day old baby cyanotic. Then the most common congenital heart is TGA. If I talk about older children, like as in a 1 month old, 6 months old, 1 year old, then the most common cyanotic congenital heart is nothing but TOF, that is nothing but tetralogy of Fallot. Okay, next question please. Yeah, this part we have off this question we have done. Which is the most common life-threatening GIT emergency in a newborn? In a newborn, which is the most common GIT life-threatening emergency? GIT problem is NEC. What is NEC? Necrotizing enterocolitis. Basically, it will be like a preterm baby. The more the baby is preterm. What is preterm? Less than 37 weeks is nothing but a preterm baby. The more the baby is preterm, the GIT is more immature or premature, something like that. And that is why they can have a GIT problem known as necrotizing enterocolitis. Life is beautiful, guys. You have to study. Successful is the one who enjoys his daily routine. Successful is the one who is enriching himself with good knowledge. So make sure you are a very positive soul. Make sure you are a very hopeful soul, and make sure you are always manifesting. Write somewhere that I have cleared this exam. Write it right now. You should dream what you want. I will clear this exam. I want to clear this exam. No, right? I have cleared this exam. My rank is between first 500. Write it. What rank do you want? And automatically it will happen. And someday it will happen. Let me know. My number is 9999897081. Okay, necrotizing enterocolitis, we all know that it is very common in preterm babies, I told you, and the main problem is their gut immaturity. The more the baby is premature, the more the baby's gut will be very immature and all that, and that's why they have this problem. Infant with NAC in OPD, they come to you with blood in stool or refusal to feed with vomiting. In your MCQ, the child will be a preterm baby who is having abdominal distension, who is not feeding well. Then preterm baby not feeding well, GIT problem, you will think of NAC. What is the name of the staging for NEC? It is modified Bell's staging, number 1. Number 2, which is the most commonest cause of neonatal mortality in India? The most commonest cause of neonatal mortality in India, the mnemonic we have is Punjab National Bank, PNB. P for prematurity, N for neonatal infections, P for prematurity, N for neonatal infections, and B for birth asphyxia. B for birth asphyxia. So prematurity, neonatal infections, and birth asphyxia. Punjab National Bank is the mnemonic we have for the neonatal mortality in India. Number 1, there's something known as caput succedaneum, something known as cephalhematoma. The babies who are born because of prolonged labor, they have a swelling over the head, that edematous swelling over the head, which is because of prolonged labor, that is caput succedaneum. And this is basically a diffuse swelling. It is a diffuse swelling. Whereas babies who are born because of, I would say, traumatic delivery, or I would say forceps delivery, or any trauma to the during delivery, that will lead to trauma to a head known as cephalhematoma. And the most common location for a cephalhematoma is parietal lobe, that is a PYQ. Cephalhematoma, we all know, it is limited to the suture line, whereas caput succedaneum, it is a diffuse swelling. And as the name says, hematoma, cephalhematoma can cause jaundice, whereas caput succedaneum will not cause jaundice. Which is the most commonest cause of neonatal sepsis in India? In India, the most commonest cause of neonatal sepsis is Acinetobacter followed by Klebsiella. The most commonest cause of neonatal sepsis throughout the world is E. coli. That also one extra point you should know. Which is the most common congenital anomaly of the esophagus? Esophagus main problem, it is esophageal atresia, or nothing but something known as tracheoesophageal fistula. How many types of TEF do we know? We have 5 types. A, B, C, D, E is the 5 types. Which is the most commonest type of TEF? The mnemonic is CAD. The most commonest is type C, followed by type A, and the least common is type D. Very important exam question. What is the meaning of this type C? The meaning of type C is nothing but you have the upper esophagus ends in a blind pouch, and the TEF is distal. That is what you should know. A nurse should immediately report if there is a dislodgement of orogastric or nasogastric tube in a newborn, as it suggests TF. So dislodgement, normally a nasogastric tube should go from the nose to the tummy, but from the nose, if there is a coiling of the NG tube, then you definitely think of TEF. Which is the most common surgical disorder in an infant? Newborn baby surgical problem, stomach problem, CHPS, congenital hypertrophic pyloric stenosis. Mother would have taken which drug during pregnancy? If the mother has taken erythromycin during pregnancy, the baby can land up into CHPS. How the patient will present of CHPS? Very importantly, pyloric stenosis. So if this is the stomach and this is the pyloric stenosis, this part is pylorus. So pyloric stenosis there, doctor, whatever I'm feeding my child, he is vomiting, vomiting, vomiting. The baby vomit, vomit, vomit. This is a very importantly non-bilious projectile postprandial vomiting. Postprandial means after the meal. Projectile means like a stretch, and non-bilious means non-greenish. So baby vomit, 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 vomit. All the acid goes out, and the baby's body will have metabolic alkalosis. The baby's body will have metabolic alkalosis. Number one. Number two, very importantly, it is a congenital problem, but the age group we see over here is 2 to 6 weeks. What is the name of the surgery for this pyloric stenosis? It is Ramstead pyloromyotomy. It is the Ramstead pyloromyotomy. Number one. Number two, baby vomit, 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 and naturally the baby will have dehydration and weight loss. That is one thing, and the patient will have a olive shaped mass. This milk which will go, no, so it will behave like a olive shaped mass, and then the baby will vomit that. Which is the most common congenital anomaly of the GIT? The most common congenital anomaly of the GIT is Meckel's diverticulum. Meckel's diverticulum, we'll all know it is like a bulge, like a outpouching in the lower part of the intestine, and very importantly, it is a remnant of vitellointestinal duct. It's important. And Meckel's diverticulum, very importantly, painless rectal bleeding. In your MCQ, if the patient has painless rectal bleeding, definitely you must think regarding the Meckel's diverticulum. That's it. Most common extra-intestinal manifestation of celiac disease is definitely, most common extra-intestinal manifestation seen in celiac disease, gluten sensitivity. Yeah, actually, that's right. In general, gluten, like celiac disease, whatever my baby eats, he goes to washroom. Whatever my baby eats, he goes to washroom. So what all he eats, he goes to washroom means barley bro is something he should not eat, because whenever he eat this, he goes to washroom. So B for barley, R for rye, O for oats, and W for wheat. O for oats and W for wheat. So it's a problem, basically a gluten problem. So baby will have whatever he eats, he go to washroom. Whatever he eats, he goes to washroom. In your MCQ, the patient will have chronic diarrhea. Diarrhea. The patient will have weight loss. Diarrhea. The patient can even land up as constipation also. Like 5 days continuously, if I start having diarrhea, I'll end up having constipation later. So the baby, whatever he eats, the baby goes to washroom. It's a gluten problem. This is not allowed. This bro is not allowed. What else? Chronic diarrhea the patient will have. And the most common extra-intestinal clinical feature for this problem, intestinal is diarrhea and constipation, but the extra-intestinal one, remember, is iron deficiency anemia. The baby will not be able to gain weight and height, because he is having diarrhea. So iron deficiency anemia is the most common extra-intestinal manifestation of celiac disease. That finishes the first part. Thank you so much, everyone. Lots of love and respect. Thank you so much for all the love and support you guys have given. You have to get this exam is really important. I'm telling you are now more than 18 years old. Your parents are not watching you whether you are studying or not. It's you and you, only you are the hero of your life. You are the superstar of your life. You are the rock star of your life. Better make something good out of it. You can, yes, definitely you can cry, oh my god, I don't have time, I have this problem, that problem. Definitely you can cry whole life. Or you can say, whatever options I have, let me do the best of what I can do, and everything will make sense by the end of the journey. All you have to do is keep the hope alive. So please take care, and thank you. Hello everyone, welcome to Pediatrics by Dr. Anand. So let's continue now. Life is beautiful. We have to work hard, positively shine, and just enjoy this life so that God also is watching at us and he's saying, Chalo, I'm really happy. At least one person is happy with whatever I have given him. So God has given us everything. We only start cribbing and start, jumping here and there and say, I wish I had little more that thing. I wish I had little more that thing. So should not do that. So let's revise again, which is the most commonest cause of chronic diarrhea in pediatric age group. The most commonest cause of chronic diarrhea in pediatric age group, very importantly, is nothing but celiac disease. Remember, chronic diarrhea, celiac, gluten problem, gluten, remember that? So we all know celiac disease patients suffering from anemia, growth failure and iron deficiency anemia, and chronic dehydration. This is a very important MCQ, which is the most common extra intestinal manifestation of celiac disease. The answer is iron deficiency anemia. This is one thing is there. Okay, in some, this part will leave it. In some neonates, a foot abnormality is there, which is known as CTEV. Yes, we all know that there is something known as congenital talipes equinus varus deformity. CTEV is one variety we must know, which is also known as clubfoot. Talipes equinovirus is a plantar flexion of ankle and foot caused due to various problems like intrauterine compression in case of large baby or something like that. So yeah, I know. Just remember, CTEV clubfoot is an image-based question, and that's it. Neonatal resuscitation, indication of bag and mass ventilation. Yes, this is an important question. When the baby's heart rate is less than 100, you start bag and mass ventilation. Indication of bag and mass ventilation along with chest compression is that's true. Heart rate less than 60. Yes, if the heart rate is less than 60 in a newborn baby, what do? You do chest compressions and bag and mass ventilation in the ratio of 3:1. That is one thing. Okay, next question, initial steps. If I ask you a question, what are the initial steps of a baby, do you know? So normally what happens whenever a baby comes to us, we check whether the baby is crying or not. If the baby is not crying, we will do initial steps. What is initial steps? That is PSSR, that is position, suction, stimulation and reposition. So position, suction, stimulation and reposition. And how do you stimulate a baby? That is, the answer is rub the back and tickle the sole. Rub the back and tickle the sole, and that's how we stimulate a baby. Number one, what is the absolute contraindication of bag and mass ventilation? The answer is congenital diaphragmatic hernia. If you're doing a bag and mass to a baby, 1 2 push, 1 2 push, 1 2 push. For how long do you do bag and mass? If I ask you a simple question, what is the normal respiratory rate of a newborn? The normal respiratory rate of a newborn is 40 to 60 per minute. So that much only, 1 2 push, 1 2 push, 1 2 push, bag and mass you will be doing. What is the recommended pressure for bag and mass ventilation? This 1 2 push, that pressure which you're giving is 30 to 40 centimeter of water for the first breath, and half of that, around 15 to 20 centimeter of water for the subsequent breaths. Okay, that you should know. And yeah, that only. An umbo bag or bag and mass ventilation or positive pressure ventilation, all are the same thing. An umbo bag, 1 2 push, that bag, it is a self-inflating bag. Number one, when does neck holding come? So we all know that neck holding comes by 3 months. So neck holding comes by 3 months, and complete head control, complete neck control, if I talk about, complete control comes by 5 months. So neck holding comes by 3 months, but complete neck control comes by 5 months. Okay, this is one thing. Okay, and 5 to 6 months baby, he basically have a mirror play. He watch and enjoys himself while looking at the mirror. Comes by 5 to 6 months, so that you should know. Now, very importantly, sitting with support, sitting without support, standing with support, standing without support. So sitting with support comes by 6 months, sitting without support comes by 8 months, standing with support comes by 9 months, and standing without support comes by 1 year. Like, very regular question. If a 1-year-old can independently stand, then he will do what? If the 1-year-old can stand, then he will walk. The 15 months baby can walk alone, whereas 18 months baby can run. 18 months baby can run. And one very regular question, when does a baby knows his full name, age and sex? I am Rahul, I am a boy. A baby knows his full name, age and sex by 3 years, and a baby can go to toilet alone. A baby can go to toilet alone by 4 years. A baby can go to toilet alone by 4 years. Tricycle, tri means 3, so 3-year-old can ride a tricycle, 4-year-old can do hopping, and 5-year-old can do skipping. So tricycle, hopping and skipping, that also you should know. Tricycle baby can play by 3 years, hopping comes by 4 years, and skipping comes by 5 years. And even a 5-year-old can tie the shoelaces also, that also you should know, that a 5-year-old baby can tie the shoelaces. Done, finish, that you should know. Okay, regarding the dentition, you should know, which is the first temporary teeth to appear in a baby. The first temporary teeth to appear in a baby is the lower central incisor, which comes by 6 to 7 months. Which is the first permanent teeth to appear in a baby? The first permanent teeth to appear in a baby is M1, which basically first molar, which comes by 6 to 7 years. So these are the basic things you should know. Next, what's the normal heart rate of a newborn? The normal heart rate of a 1 to 2-year-old baby is 80 to 130 beats per minute, but heart rate of a newborn is important, that is 120 to 160 beats per minute. The normal respiratory rate of a newborn also is important, that is 40 to 60 per minute. Number 1. Number 2, very importantly, acrocyanosis. Do you see acrocyanosis in a newborn? Yes, we can see. Acro means periphery and cyanosis means bluish discoloration. So yes, acrocyanosis in a baby is one of the conditions in a newborn which looks abnormal. You might admit the child, but it is normal, that you should know. The capillary filling time, CFT, we all know capillary filling time, usually it is less than 3 seconds. That is one thing you should know. The one more question they asked regarding the lanugo. What is lanugo? Lanugo are the hair at the shoulder and the back. Lanugo are the hair at the shoulder and the back. So where do you see lanugo? Lanugo is only and only seen in preterm babies. Lanugo are the hair at the shoulder and the back. What is the normal temperature of labor room? The normal temperature of labor room is around 25 to 28 degrees Celsius. One book has written 22 to 26 degrees Celsius, like a touching thing only, so it's same, no problem. What is the normal temperature of a newborn? The normal temperature of a newborn is 36.5 to 37.5. If the baby has temperature 36 to 36.5, that is mild hypothermia. 32 to 36 is moderate hypothermia, and less than 32 is severe hypothermia. And this mild hypothermia exam question, please remember, it is also known as cold stress. It is also known as cold stress. Done. And one more thing also you should know, this part is done. Okay. And normally body temperature in a newborn baby is regulated by the breakdown of brown fat. Like normally we can shiver like this, but a newborn baby cannot shiver. A newborn baby cannot shiver because they do thermogenesis by the breakdown of brown fat. And the question is, where all the brown fat is present? It is present at the neck, at the axilla, between the scapula, renal and adrenal. So that, remember, newborn baby have a non-shivering thermogenesis. We have a shivering, we can shiver, and then we have a heat production, thermogenesis. Newborn baby have a non-shivering thermogenesis. Remember that. Okay. Next question, very importantly, there are various methods of heat loss we have in a newborn. If I put the baby on a cold surface, if I put the baby on a cold surface of the nursery, the mechanism of heat loss is known as conduction. If you put the baby, you can say, if I ask you this one, conduction, convection. If you put the baby near a fan or an open window, then that mechanism of heat loss is known as convection. The method of heat loss which happens through the skin, that is known as evaporation. And if you keep the baby near a cold wall of the nursery, that method of heat loss is known as radiation. So these were the important top 2 points again regarding this one. Thank you so much everyone. In the next segment we're going to study the other slides. And remember, life is beautiful. Remember, you have to get this clear. Okay, you have to get this exam done. It's very important how much you have worked hard, little bit more, and you'll be there. Again, just because तुम्हारी लापरवाही की वजह से लंबा टाइम ना प्रॉब्लम हो जाए, just because of you being not so serious, suddenly something bad shouldn't happen. Please be serious, finish the syllabus, and life is beautiful. Please take care and thank you.